Hey, what's up everyone? This is Julie Reynolds, aka Nurse Jar. In this training video, I'll be demonstrating the 2022 Pearson VUE and Credentia testable skill applies one knee-high elastic stocking. This skill is performed on a mannequin. However, there are a couple of instances in where the nurse aid evaluator will instruct you to perform this skill on a live person. One, if the mannequin's foot is too big, and two, if the mannequin's foot is too wobbly. Okay, but normally it is performed on a mannequin. I want you to keep one thing in mind for you Pearson VUE and Credentia test takers. Your supplies will be located on a centralized table somewhere in the testing room. I have my supplies set up for prometric testing, okay? So just keep that in mind. So let's go ahead and get started. Hi, good morning, Mrs. Jones. How are you? Awesome. My name is Julie. I'm your CNA, and today I'll be applying your stocking on your right leg, okay? All right, Mrs. Jones. First, I just want to make sure your bed is in a low safe level, and it is. Your bed wheels are locked. I'm going to give you your call light in your hand. Just press this button right here if you need anything, okay? All right, Mrs. Jones, I'm going to lower your head of bed because I need you to be completely flat while I'm placing the stocking, okay? There we go. And I'm going to provide you with privacy by closing your privacy screen. Mrs. Jones, I'm going to go wash my hands and gather my supplies, and I'll be right back, okay? All right. Washing hands. Now again, remember, for Pearson VUE and Credentia test takers, your supplies will be located on a centralized table somewhere in the testing area, okay? So if you walk out of the room before you re-enter, you'll want to re-knock. Hi, Mrs. Jones, it's me, Julie, your CNA. I have the stocking and I'm gonna go ahead and put it on your leg, okay? So the only supply that you'll need to collect for this skill is one knee-high elastic stocking, all right? So when you're performing this skill, again, you wanna make sure that the head of bed is flat so the person is lying in supine position. Now, the first step is turning the stocking inside out. And the easiest way to do that is to place your arm inside the stocking. And where you have the blue heel, you just want to pinch it, okay, at the edge that's closer to you. Holding that pinch, you'll pull the stocking inside out. Voila, okay? Now keep in mind, this is an elastic stocking, so it can stretch, okay? Really good, all right? Mrs. Jones, I'm going to uncover your right leg, okay? So in order to avoid overexposing the person, you'll only want to uncover the leg that you're going to be working with. In this case, I'm going to place the stocking on Mrs. Jones's right leg. So I have only her right leg exposed. Now that I have my stocking turned inside out, what I'm going to do is I'm going to hold the stocking to where I can see the blue heel. So I'm looking at the blue heel is looking at me. You can either stand on the side of the bed or the foot of the bed, whichever is more comfortable for you. For me, I'm going to stand at the foot of the bed while placing the stocking. So what I'm going to do is I'm going to open the stocking up. I'm going to stretch it very wide. And then I'm going to place the stocking over the toes, the foot. And when I lift the heel of the foot, I'm going to support underneath the ankle joint and pull the stocking over the heel. Then I'm going to place the resident's foot back down on the bed. Now that I have the stocking placed over the toes, foot, and heel, I'm going to take my thumbs and I'm going to go down as far as I can with my thumbs. Again, while lifting the foot off of the bed, I'm going to support underneath the ankle joint. I'm going to pull the stocking over the heel, and before I pull it all the way up on the leg, you can see where the heel is. Now this blue heel has to be completely covering the heel of the person's foot. So before I pull the stocking all the way up, I'm going to go ahead and readjust the stocking so where the heel of the stocking is completely covering the heel of the person's foot. This will give me a little bit more leadway. Okay, so I'm just gonna hold up the mannequin's leg. You do not want to do this during testing, okay? I'm just doing this to show you how I have the heel of the stocking covering the entire heel of the person's foot. Once you get that done, now you can pull the stocking all the way up the person's leg. And you have to end the skill again where the stocking is nice and smooth. There's no wrinkles or twist, and the heel of the stocking is completely covering the heel of the person's foot. If you're having difficulty getting all of the wrinkles out, you can always verbalize that the stocking is wrinkle free, and you'll still receive credit for that step. Okay, so now what I'm going to do is I'm going to recover Mrs. Jones's leg. Just going to do closing procedures. Okay, Mrs. Jones, I have your stocking on your right leg. Before I leave, I'm just going to make sure that your bed remains in a low safe position. Bed wheels are locked. You still have your call light in hand and privacy is maintained. Is there anything else I can do for you? All right, Mrs. Jones, you have a good day, okay? At this time, I will verbalize washing my hands, skill complete. All right, guys, that's it. This is a POV video, point of view video, so you are able to see up close and personal how to perform this skill. I hope you enjoyed, and I hope you have learned. Thank you.